Hello, today I'm going to show you how to enter the information for your Trauma Physical Assessment Adult Individual Skill Scenario, which appears in the blue column of Table 2 on the Appendix G document. First, you will need to log in to Platinum Planner utilizing the credentials that you entered when you set up your Platinum Planner and EMStesting.com access. You will click on the login link at the top right of the page in order to log in. I'm already logged in. Once you log in, you will be directed to the PlatinumEd.com dashboard as you currently see on my screen. You will not have as many options as you see on my screen under the EMS Testing and Platinum Planner section of the page. Under the Platinum Planner section of the dashboard, you will click on the Student Role link. You will be directed to the Student Home section of Platinum Planner. About halfway down the page, under the Items which may require your attention area, you will find Labs, Scenarios, and Opportunities that require your attention. Labs are assessments that normally involve a specific skill. Scenarios are more comprehensive assessments of your psychomotor knowledge, and opportunities are your clinical and field shifts. You will click on the Lab is Ready to be Documented link. You will be directed to the Student Managed Labs area of Platinum Planner website. You want to click on the Edit Documentation area under the Actions column. You will now see all skills that are being assessed during that particular lab. It's very important that you please note that if you do not see the individual skill scenario lab, the most likely reason for this is that you have not completed your documentation for, submitted, and had your individual skill evaluation lab for the Trauma Physical Assessment Adult completed by your instructor. You must have the individual skill evaluation lab approved by the instructor before you will see the individual skill scenario labs. For this video's purpose, we are going to pick the Trauma Physical Assessment Adult skill. And you notice that that's the individual scenario. According to Appendix G, you must complete and record 2 of these skills at a minimum. Once you click on the skill, you will see the green Add New Attempt button. Click that button. A skill form box will pop up at this point with the components of that skill. Choose the time the skill was completed in military time. The age of your patient, if applicable. The patient type, which you have choices of cadaver, live, low fidelity, and high fidelity, just like you did for the individual skill evaluation. We will pick low fidelity today. You do notice that there's a notes box where you can type in notes that are constructive for that skill. And then for this particular skill, you do not have the choices of peer reviewer as a classmate because it automatically defaults that this has to be approved by an instructor. So you don't have an option to choose who your evaluator is. You will now enter the ratings for each of the areas of the skill, much like you did for your individual skills evaluations. You note once again that the 2 is already chosen for ease of use. If you feel that the rating should be less than a 2, please indicate that. You will scroll down the page until you get to the critical criteria. Once again, if you choose a critical criteria, that could warrant a failing grade. You now have the option for your student self-reflection. Do you feel that you were successful or unsuccessful in the skill? And once again, Unsuccessful is only chosen if you score less than 78% on that particular skill. You can type in comments for the evaluator that are once again constructive comments, and then you type in the evaluator's name. There is no need to enter in an evaluator signature. At the bottom of the page, you must click whether the skill attempt was successful or unsuccessful. It is successful as long as it's above a 78% of the total points. You will now click on the blue Save button at the bottom right of this text box. You'll be taken back to the Skills Performed area. You will note that the skill that was just entered appears with a green check mark next to the skill attempt. You may now enter another skill if needed. Once you are done documenting all of your skills for that lab night, you click on the Submit Lab tab. You may type a message to your instructor if needed. Please read the statements about reviewing your documentation prior to submitting the lab, and then click on the blue Submit Documentation button. Once you have clicked on the blue Submit Documentation button, the lab will be submitted to your instructor for their review and either acceptance or denial. Please watch additional videos on how to enter other skills in Platinum Planner on the Paramedic YouTube page.